Why am I passionate about nursing? Well, my aunt is a registered nurse and she inspired me to become one too. I looked up to her as a young woman and I went on to nursing school to follow in her footsteps. I was amazed at how she helped her patients after cardiac surgery, one of the most difficult times of their lives. I thought then, and still today, what an immense privilege it is to be a registered nurse. As I advanced in my own education, I found that nursing not only provides wonderful care to people in their times of need, but takes a different perspective than other professions. It's about how we think about and practice caring. We take a broad perspective to what caring means. It includes the patient, their family, and their community. I love this holistic approach of the nursing profession. Another reason that I'm passionate about nursing is our preventive approach, and in my case, specifically about the prevention of intergenerational trauma in families. For 20 years, I've been developing and testing nursing interventions designed for childbearing families affected by risks, such as postpartum depression and poverty. I am passionate about the ability of nursing to help give new families at high risk the best start possible. I was named a change agent by Alberta Health Services for this work and also received research awards from CARNA and the Canadian Association of Schools of Nursing. So I'm passionate about nursing because we wield tremendous skill and knowledge that helps people at some of the most important and vulnerable times of their lives, that we care for the whole person, and that we take a preventive approach to health. What a privilege to promote health and reduce suffering. Why do I think I'm a good fit for the position? One of the reasons is that I have experience on the CARNA board. I was fortunate to have been elected to represent Calgary West nearly 2 years ago. During this time, I've been so inspired by the work of my colleagues, and I've really grown understanding the issues facing Alberta registered nurses. For example, I'm really proud of the work we've started with our Indigenous Advisory Committee to help us understand and support registered nurses working with Indigenous people, their families, and communities in Alberta. Another example relates to the national dialogue about the growing recognition of the larger nursing family, including licensed practical nurses alongside registered nurses and nurse practitioners. Working together is the best way forward for the nursing profession and the health of Albertans. My understanding of the issues will help ensure that registered nurses remain at the forefront of healthcare in Alberta. One more example of my fit for the position of President-Elect is my board and governance experience, not only at CARNA. I've served 7 years representing nursing and nurse researchers on the Governing Council of Canada's National Health Research Funder, the Canadian Institutes of Health Research, helping oversee an annual budget of $1 billion. Often I was the only RN and the only woman at the table, and there I developed the courage to voice my opinion, to address issues, even when it felt hard. I continue to take part in governance and currently serve on the board of Discovery House Women's Shelter in Calgary. I really enjoy governance and contributing to dialogues that are going to move the needle forward for the nursing profession, healthcare, and the health of Albertans and Canadians. In summary, I'm a good fit because I understand the issues facing Alberta registered nurses and I have the right experience to be successful as President-Elect and make a difference for nursing in Alberta. What is my vision for registered nursing in Alberta? My vision is an outcome of 3 key goals that I would seek to achieve with CARNA. First, I would work to raise the profile of registered nursing in Alberta. Second, I would work to ensure that CARNA fulfills its dual mandate of advocacy for the registered nursing profession as well as regulation. Third, I would continue and re-energize CARNA's work to enable registered nurses and nurse practitioners to be able to practice to their full scope. If these goals are met, we will achieve my vision of improving the quality of nursing healthcare and health of Albertans. To raise the profile of registered nursing in Alberta, I will work with my CARNA colleagues to develop an innovative social media and marketing campaign that highlights the effectiveness of outstanding Alberta registered nurses working in a wide variety of settings. Registered nurses are making a difference everywhere. To achieve the second goal, I will encourage my CARNA colleagues to embrace the dual mandate of CARNA. We have done a terrific job of ensuring the public receive top quality, safe care through outstanding regulation. What I would like to see is a shift towards more advocacy for registered nurses and nurse practitioners. Achieving the first and second goals would also help achieve my third goal of enabling all CARNA nurses to practice to their full scope. I am passionate about raising the profile of the nursing profession through advocacy so that nurses can be granted this ability. So much so that for the past 20 years I've been focused on demonstrating the effectiveness of registered nursing care, services, and programs compared to other approaches or standard care. What I want to do now is take this advocacy one step further by working in regulation and advocacy as part of CARNA. As President-Elect, I will work very hard to raise the profile of our profession, to listen to CARNA members, and to bring together the experts we need to make the biggest impact on policy affecting not only our profession of nursing, but health and healthcare of Albertans. I will do my very best to serve you in CARNA as President-Elect. Please support me in the CARNA election. Thank you very much.